Hello, hello. Hi, guys. Happy Tuesday? Is it Tuesday? Happy Tuesday. I'm so glad you're all joining me today for a conversation with Dr. Rachel Dolhun from the Michael J. Fox Foundation. Let me see if I can get her on. You guys know this is always my hardest part. We haven't done a live in a while, so I'm so glad to be back into it. In Sweden. Is it nice in Sweden right now? Gosh, I'd love to be in Sweden. So today we are talking about women and Parkinson's, obviously a topic close to my heart, being a woman with Parkinson's. Hi from Lewis, Delaware. Hi from Michigan. Gosh, you guys are all over. That's so cool. And Dr. Dolhun is the principal medical advisor for the Michael J. Fox Foundation. I've met her a couple of times at different events. She's incredibly knowledgeable about all things related to Parkinson's, but we've had some good chats about what it's like to be a woman with PD. And so I'm really excited to see if I can get her on. Oh, here we go. Let me see. See if that works. Sometimes on lives you have to do it like 6 times. Okay, let's try one more time. It says Michael J. Fox Foundation is unable to join. Let's try again. So we're going to talk about what it's like to be a woman with Parkinson's, how it differentiates. Oh, there you are. It's always the worst part is getting on.
I heard you talking and I was like frantically trying to get in and request.
I always warn people that it's like hit or miss. Yeah. Sometimes it takes like 4 or 5 times. Anyways, thank you so much for joining me today. I'm so glad to have you.
Oh, it's so fun to be here. Thanks for inviting me.
Of course. So obviously, being a woman with Parkinson's, this is a topic near and dear. Oh, hi from Italy. Wow, everybody's all over today. That's so cool. In England. You've attracted a worldwide audience, Dr. Dolhun, literally. So when I was first diagnosed, I was told that by a neurologist, a general neurologist, that being a woman with Parkinson's was exceptionally rare. And I've since done some of my own research, and I think that's not entirely a good description of what it means in terms of prevalence. But I thought we could start with how many women does research tell us have Parkinson's? Is it truly exceptionally rare that it is mostly men who have this disease, or is that sort of a myth?
Yeah, well, it's never good to be rare or exceptional in medicine. Right? Like you never want to be the novelty. But I mean, it is true that Parkinson's does happen less frequently in women than in men. So what we see from the data is that men are about 1.5 times more likely to have Parkinson's than women. So if we break that down, it's about 60% men perhaps and 40% women that are living with Parkinson's. But I think where you have an advantage or a disadvantage is you were younger when you were diagnosed, yes. Right? So you were less than 50, which is what we call early or young onset Parkinson's. And so being a woman and then having young onset which happens in maybe 10 to at most 20% of people with Parkinson's, it's kind of that double hit that you sort of had. Like I said, being a woman and then being younger.
Okay. At that. So generally speaking, women are about 40%. So that could be age ranging from young onset all the way through sort of older.
That's right.
Regular Parkinson's.
Yeah, and for women or for men, the most common age at diagnosis is around the 60s. So again, most people are going to be diagnosed later in life, and we can talk a little bit more about how that differs in women with menopause and how hormones are changing and that sort of thing. But again, the most common age at diagnosis is around 60s, late 50s, early 60s. But then about 10 to 20% of people are diagnosed age 50 or younger.
Okay. And so do we know why it's roughly 60 to 40 men versus women? Are women biologically protected from some of the Parkinson's related disease or something like that? Or is it just luck of the draw?
Yeah, or unluck of the draw.
Or
There
unluck of the
are
draw.
a lot of theories about why this might happen. So one I alluded to already is estrogen. So this is a hormone that's higher in women throughout life. It does fluctuate. Of course, falls around the time of menopause when menstrual cycles stop. But theories, there are theories that estrogen is actually protective. So helps protect the brain, also helps with dopamine signaling. Dopamine is that brain chemical that helps with normal movement, that decreases in Parkinson's, could maybe help with decreased inflammation or even antioxidant effects, which is again all part of what comes on to cause Parkinson's. So could estrogen quite simply just be helping protect us and our brains over our lives? And that's perhaps why women have a lower rate of diagnosis.
And so does that make sense then to you? And this is kind of guessing, I guess, but that as our estrogen levels drop, that the incidence of Parkinson's goes up? Is that why it's more rare for younger, I mean, hypothetically, conceivably rarer for younger women to have it?
Exactly. Hypothetically, it would make sense, and that's why this is a theory. So after, is it after menopause when those levels drop that we see the rate of Parkinson's increase in women? We also know or hear from women that symptoms fluctuate as hormones fluctuate. So our hormones are fluctuating throughout our menstrual cycles, and a lot of women. There was just a survey that was put out by one of your fellow patient council members, Sonia Mather, and her colleagues, looking into this, and the women who responded reported that their symptoms were fluctuating with the changes in hormones throughout their menstrual cycle. So we certainly see that hormones are playing a role both in potentially disease onset as well as disease experience. There's just a lot more work that we have to do to parse all of this out.
So I read somewhere that, I think you might have said it, that we as women were not included in research studies until the 80s. Is that true?
Which is crazy, right? I mean, that's in our lifetime, right? When we always think about these things, I always think that's long, in the archaic times. But yeah, it wasn't until the 1980s that policies were put forth by the NIH to mandate that women be included in research. And I mean, when you think about it, it makes sense from a sort of protective standpoint. Women are getting pregnant or potentially getting pregnant, and we want research to be as safe as possible. There's even some of that now that comes into play when women are when women are participating in research, and do we want to make sure that people aren't getting pregnant because we don't want to have any unintended implications or consequences when we're testing a new drug or those sorts of things. So, in some regard, it makes sense, and I understand where it came from. But on the other hand, it's why we don't have good data. And also, I feel like as a woman, I don't have Parkinson's, but I'm a woman. I feel like there's not, in general, as much attention to women's issues, Parkinson's or not, whether it's menopause or hormonal fluctuations during menstrual cycles. And so there's a lot of work just in general, women, Parkinson's or not, that we have to do to make research more representative so that our findings are more broadly applicable.
Yeah, and I think, we've come up in a generation, and it's shifting now. I see it with my daughter and sort of her friends, where talking about women's issues and menstruation and hormones and menopause, all of that was sort of taboo when I was little. And now they're very open about it, which is amazing.
They're
and I
also taking much better care of their skin. We didn't do
the skin routines. Although I did love my Clinique skin routine when I was little, but yeah, they're just there's a generational shift, it seems, where we are now talking about these things openly. People are embracing it. So we don't know a lot, or I guess we still have a long way to learn about women's hormones and the fluctuations. I actually had a hysterectomy because of endometriosis. So I actually don't have the sort of fluctuations that people talk about with Parkinson's, but I hear anecdotally that some women's cycles do change sort of their symptoms, the intensity of the symptoms. Do we have any data around that, or are we still sort of figuring that out?
So most of the recent data came out of that survey that I just mentioned, which was actually spearheaded and implemented by women who are living with Parkinson's, which is also amazing. You know, people just kind of seeing a problem and solving it on their own. But in that survey, what they found is that the majority of women do say their symptoms increase in the week before their menstrual cycle. And then about 50% say during their menstrual cycle, symptoms worsen. So we're starting to learn more, you know, and by sharing your experiences, to your point, by us talking openly about these things, you know, these are a normal part of life. Right. And so we just have to be able to be open and discuss them so that we can understand what others' experiences are, and we can get better data, and we can better treat and address these things. But the other thing I would say about kind of figuring this out on your own, you know, another thing in the survey was the majority of people said their doctors don't ask about it, which is unfortunate, but also probably not a surprise. And so this too comes back to where, unfortunately, in our healthcare and in our medical system, a lot of the burden falls on us as patients. And I'll say, you know, from my personal experience, I have migraines, and I notice they change a lot with my hormones or with my menstrual cycles. And so what I did is just simply start keeping a log. And so I can track and go, you know, I can take that into my doctor and say, look, I had 5 migraines during the week before my menstrual cycle, or I had, you know, you have this data then. First of all, you understand yourself and your Parkinson's or your medical condition better. And then second of all, you're armed with data about yourself. And you can do it, like I said, it can be simple, a pen and paper, and just do it for a couple of months. Or there are apps too that are starting to help people track these things a little bit better as well.
I love my doctor very, very much. I can't imagine having that conversation with him. I mean, he would, I'm sure, be open to it, but it's just kind of, in some cases, it's like, I mean, he's older, and it would be like talking about it with my dad. My daughter is open about it in front of everyone, including my husband, but I feel like generationally, I'm not quite there yet. Although, we're going to get over it. We're going to get over our embarrassment about such things, because it's so important. And I think, you know, we're so accustomed to talking about it with our OBGYN or our gynecologist. It's like, I rarely talk about it with my GP, my general practitioner. I certainly have never talked about it with my neurologist, but I think it's something, I mean, obviously it doesn't necessarily pertain to me anymore, but I think it's something, the more we are open about it with each other too, it can only make things better, because, you know, it's just, it's women are such a great mystery, but it feels like this doesn't need to be
your point. I totally understand and acknowledge that this, you know, this, like sex is something we don't want to talk about with our doctor, or even mood changes for a lot of people.
Yeah.
And so there's, you know, there's a lot of stigma, there's a lot of, you know, just fear, embarrassment, all of these kinds of things. But it's also an opportunity for us to be educating our doctors. You know, they're not asking about these things. If you have a doctor who's engaged and curious, they're going to learn right along with you, and they should. And so it's, you know, like I said, it's an opportunity for us to be opening these conversations and educating doctors who may not have learned about this in residency or medical school, might not know all about hormones. And so we're helping educate them and teach them through our experiences.
Is there any data on hormone replacement therapy as it pertains to Parkinson's? Is it something people should discuss with their neurologist? Is it something to be avoided, or are they unrelated?
It's a really hard question to answer, because the research here on hormone replacement therapy in general, and then hormone replacement therapy for Parkinson's, is really conflicting. So you've probably heard about with hormone replacement therapy, and we think about this for, you know, mainly after what you mentioned, like hysterectomy or surgical menopause, which is where we remove the uterus and the ovaries for whatever reason, and hormone levels fall, so we can replace them then. Or after natural menopause, which is what happens at around age 50 for most people. Our menstrual cycles kind of get irregular, and then they stop for at least a year, and then that's when we're, you know, declared in menopause. And so we think about, you know, potentially replacing